Sydney's COVID testing strain is intensifying as a major pathology centre shuts sites across Sydney. Jessica Maggio is live in Sydney. Jessica, the centre says it's struggling with a major backlog.
That's right. 28 drive-through and walk-in testing clinics have been shut down across Sydney as it tries to return the results of many already swabs that have been already taken, I should say. They've said that they've shut down effective immediately and indefinitely, but their website has stated that some will be reopening progressively throughout the day in order for residents to continue testing tomorrow. They say that staff are working around the clock. They say this is an unprecedented situation and we and the rest of the sector are doing everything we can to meet demand and the needs of the community. No doubt that closure will add pressure on other testing sites as people look for alternatives, but many testing clinics and sites and pathology labs say that they've almost been blindsided by the demand.
With the opening up of everything at once, the amount of people with infection was going to increase rapidly. I don't know if it was really predicted that it would increase this rapidly. I help on the collection queues, and I've said to a few people, I feel as though I didn't get the memo about this was going to suddenly happen to us all at once, and it happened very rapidly.
Authorities have encouraged the use of rapid antigen tests, but they're not readily available. In fact, they're becoming increasingly scarce. Many pharmacists and stockists say they're not expecting inventory until mid-January at least. So certainly that demand is increasing, but supply is unable to meet it. The Department of Fair Trading in New South Wales has also said that they've received at least 20 complaints of price gouging at pharmacies and stockists who are selling them for around $10 to $15 per test. So as you can imagine, that's why demand would be increasing for those free PCR tests. The Prime Minister, however, yesterday said that he wouldn't be considering any free rapid antigen tests. He says at this point in the pandemic, we should stop expecting things to be free. Of course, what he meant is that anything that's free comes at a cost for the taxpayers, but it's certainly spurred anger amongst residents and testing clinics who say they're unable to meet that demand. I'm here at Rozelle, which opened at 8 a.m, but people were lining up from around 5:30 a.m. trying to get in and out as quickly as possible. Some of them say they haven't been able to find any rapid antigen tests, though not for looking for sure. It's also that the numbers in the past 24 hours have seen testing decrease. 83,000 tests were reported, not as high as we've been seeing in the past couple of weeks. Testing sites, especially here, say that's largely due to the removal of travel PCR requirements, which has eased some burden, but certainly not enough. 23,131 cases of COVID have been reported in the past 24 hours and 2 additional deaths. 1,344 cases are in hospital and 105 are in ICU, I should say, but rather the Delta strain is still prominent in hospitalisations, accounting for around half, the New South Wales Health team has confirmed.